Since we know that eye disease is a big consequence of diabetes and uncontrolled diabetes, patients need at least once a year what's called a dilated eye exam.
A few of the eye problems that we see in people with diabetes are retinopathy, macular edema, glaucoma, cataracts. Diabetic retinopathy at the most basic level is damage to the retina, or the back part of the eye, and without the retina, you can't see. So symptoms of diabetic retinopathy can include floaters, fluctuating vision, temporary vision loss. They could have loss of color vision.
You may have significant diabetic retinopathy, yet you may have no symptoms whatsoever. That's really important. So you've had diabetes for 10 years, you think your vision is fine. That's not a reason not to see the eye doctor. The only way to diagnose diabetic retinopathy is through a thorough dilated eye examination. So that's the part of the exam where you go to the eye doctor and we put drops in your eyes, the drops that you don't like, that blur your vision.
Diabetic macular edema is a situation that occurs once someone has diabetic retinopathy. The macula is a part of the retina, which is at the back of the eye, and it's critical for sight. If the macula has bleeding within it from an abnormal blood vessel that was there because of retinopathy, that can impair vision, and that's what macular edema is. Glaucoma is an eye condition that develops in people with diabetes, especially because pressure can build up in the eyes when blood vessels are damaged.
Whether it's type 1 or type 2, you at least need an annual eye exam to make sure nothing bad is going on in the back of the eye. But the other caveat that we tell all of our patients with diabetes is, should you notice any change in your vision at any time, don't wait for that annual eye exam, get right into the office.
You know, what scares people about diabetes? It's blindness, it's kidney failure, it's toe amputation. So when I talk about the eyes, I talk about the fact that there are changes that you can make early on in treatment to avoid having eye problems. I talk about every percentage that you can reduce your A1C level confers a significantly reduced risk of developing eye disease.
When we examine the back of your eye, we can actually see the blood vessels. And if the blood vessels are looking good in the back of your eye, you have an excellent chance that they're working well everywhere in your body and that you're managing your diabetes very well.